Hello, this is the Genesee County Aetna Medicare Advantage informational meeting. All Aetna presentation materials are confidential and proprietary and may not be copied, distributed, captured, printed, or transmitted in any form without the written consent authorization of Aetna Incorporated. Welcome, Genesee County retirees. There are important changes happening to your medical coverage for 2021. We're here today to help you understand those changes. So what's happening? Effective January 1st of 2021, you will be automatically enrolled in the Aetna Medicare Advantage plan unless you choose to opt out. Aetna was chosen because it helps Genesee County maintain their commitment to continue providing retiree health benefits. The Aetna Medicare Advantage plan includes comprehensive coverage, including 100% coverage for most preventive services, predictable copays for your doctor's office visits, and benefits that complement your doctor's care and helps you maintain your total health, which includes your physical, emotional, and social health. Our commitment to Genesee County retirees is to make healthcare simple, local, and accessible to you, provide the healthcare resources that you need, and help you achieve your best health, however you define it. Here's what we'll cover today. We'll talk about Medicare and other insurance, specifically go into how the Genesee County Retiree Plan works, talk about how you can keep the doctors that you know and trust. We'll discuss extra support you'll get with your new plan, and then talk about what happens next. We think you'll find that your new Aetna Medicare Advantage plan is efficient and easy to use, and we'll show you how. Let's review the parts of Medicare. Original Medicare consists of Part A, which is your hospital benefit, and Part B, which is your medical benefit. Two additional parts of the federal Medicare program are Part C, which is where Medicare Advantage plans fit in, and Part D, which is the prescription drug benefit. Part C and Part D of the federal Medicare program can only be accessed through private insurance companies. So your Genesee County retiree medical plan is a Medicare Advantage Part C plan. To be eligible for this plan, you must have Part A and Part B of federal Medicare and continue to pay your Part B premiums. You will see supplemental plans listed, and supplemental plans work to cover the gaps in Part A and Part B. To better understand the new Aetna Medicare Advantage plan, I want to first give you a quick refresher on how many traditional plans work. In fact, for many of you, this is how your current plan works today. When you go to see your doctor, you show two ID cards. One is your original Medicare card, that's your red, white, and blue card, and the other is your medical card from the insurance company. Then after each plan pays the doctor's claim, you'll receive at least two explanation of benefits. So in this method, the payment process has many steps. You're going to carry two medical ID cards with you. You will have paperwork from your healthcare provider, Medicare, and your current medical plan. You will get multiple bills and explanation of benefits. With the Medicare Advantage plan, you get all of your medical benefits bundled together in one plan. Your Medicare Advantage plan covers everything that is covered with Part A and Part B of the federal Medicare program. The Medicare Advantage plan program gives you many additional benefits included in the plan, including wellness programs and care advocacy, With your Medicare Advantage plan, you will only have one medical ID card to show when you go to your medical providers. You will get one monthly explanation of benefits for your medical services. Please remember that Medicare Advantage plans must cover all Medicare approved services. So your Genesee County Aetna Medicare Advantage plan will cover all Part A and Part B medical services. Having an Aetna Medicare Advantage plan is easy to use. You see here a sample of your ID card. You will have this one ID card for all of your medical needs. Please keep in mind that your Aetna Medicare Advantage plan covers everything that is covered in the original Medicare Part A and Part B and gives you lots more benefits. There are health advocacy and wellness programs included with your Aetna Medicare Advantage plan. We know that one of the most important questions is whether your doctor will accept our plan. Let's review how we make it simple for you to see your doctors. The Genesee County Aetna Medicare Advantage Plan is a preferred provider organization PPO plan with extended service area, which we abbreviate ESA. And what this PPO ESA means to you is that you can go to see any doctor that is in or outside of our Aetna Medicare network and pay the same exact cost share. With this PPO ESA plan, you have access to providers nationwide. You can go to any provider who is eligible to receive Medicare payments and is willing to accept the Aetna plan. There are no referrals needed with this plan, and this plan covers you nationally when traveling. If you would like to go to a network provider, there are over 800,000 network doctors and specialists and over 3,500 network hospitals. This plan also covers you if you were to travel abroad for emergencies and urgently needed care. Your PPO ESA plan gives you the flexibility to see any provider as long as that provider is eligible to receive Medicare payments and they are willing to accept your Aetna Medicare Advantage plan. Because this is a PPO ESA plan, your copays or cost share amounts are the same for any doctor or hospital according to the cost listed in your plan benefits summary. If you would like to find out if your doctors or other providers are in our Aetna Medicare network, or if you would need assistance finding a new provider, you can call our pre-enrollment line at 1-800-307-4830, Monday through Friday, 8 a.m. to 9 p.m. Eastern Time. Let's take a look at your Genesee County medical benefits. Each Genesee County retiree is being mapped to one of two Aetna Medicare Advantage plans. The first plan that we will review is the CO2 plan. There is no premium attached to this plan. The deductible is $100. A deductible is the amount that you must pay out of your pocket before the plan benefits start to pay. The out-of-pocket maximum for this plan is $1,100. An out-of-pocket maximum is the most that you will pay out of your pocket in a calendar year for your medical benefits. Preventive care is a $0 copayment. The deductible does not apply. Your primary care office visits and specialty office visits are both $20 flat copayment. A copayment is a flat dollar amount that you will have to pay. Generally, doctors expect that payment at the time of your appointment. Inpatient hospitalization and outpatient surgery are both a 10% coinsurance. A coinsurance is a percentage of the total amount of your appointment visit. For instance, if you have a total cost for a hospital visit of $25,000, 10% of that would be $2,500. But remember, you have an out-of-pocket maximum of $1,100. So you would not pay that full 10% amount for your inpatient hospital stay. So to give you another example, if you've had 4 doctor visits in the year, that would be an $80 copay. And before those visits, you had already satisfied your $100 deductible. So that would mean that all you have left in your out-of-pocket maximum for the calendar year to pay would be $920. So if you had an inpatient hospital stay of $25,000, after you've had 4 visits to the doctor and you've paid your deductible of $100, that means the most that you'll pay for the hospital visit is $920. Emergency rooms visits are $120 copay. That copayment is waived if you're admitted to the hospital. The second plan that we will review is the Aetna Medicare Advantage Plan CO5 plan. This plan does not have a premium. The deductible for the plan is $250. Again, remember the deductible is the amount that you will pay out of your pocket before the plan benefits start to pay. The out-of-pocket maximum for this plan is also $1,100. Preventive care is a $0 copay. Deductible does not apply. Primary care office visits and specialty office visits are both a $20 copayment. Remember, the copayment is the flat dollar amount that you will pay to the doctor, typically when you arrive for your appointment. Inpatient hospital care and outpatient surgery in this plan are 20% coinsurance each. Remember, you will pay a maximum of $1,100 out of pocket for a calendar year for your medical benefits. So if you have a large inpatient hospital bill, it is likely that you will not pay the full 20%, as you will only pay up to $1,100 for all of your medical care in a calendar year. Once that out-of-pocket maximum has been met, you will pay zero costs for the remainder of the calendar year for your medical benefits. Emergency room visits on this plan is a $120 copay. It is waived if you're admitted to the hospital. We've talked about the simplicity of the plan, how there's one card, how you can keep your doctors, and we've gone through the plan design features. Now I'd like to share with you some of the support programs you're going to get with your Medicare Advantage plan. We value your total health. That's your physical, emotional, and social health. We want to help you reach your full potential in life, however you define it. We understand that our members are coming to us on different points in their healthcare journey. So some members are focused on prevention and wellness, and we have programs for that. Your plans have eye and hearing exams included, annual physicals. We send out cancer screening reminders. We have programs such as a healthy home visit, and we have a 24-hour nursing hotline. So maybe if you wake up in the middle of the night, you don't think it's an emergency, but it would make you feel better if you could speak to a nurse. So we have that. Your plan also has hearing aid reimbursements. Telehealth is included so that you can access your primary care doctor through telehealth appointments. We also understand that some of our members are coming to us and they need a little bit more support. Maybe they want to help prevent any health issues from getting worse. So we have support programs in place for members with chronic health conditions. We have readmission avoidance programs, whereas if our members are being discharged from the hospital, we have nurses that will work with them to help them stay home and heal. And we also understand that members may need some assistance when they're dealing with end of life issues. So we have a Aetna compassionate care program. One of the great things about the Aetna Medicare Advantage plan is that we always have nurses in the background watching your care. So if you are hospitalized, there are nurses that are following your care in the hospital. And if you should need to get transferred to a skilled nursing care facility, they're there to make sure that you're having a smooth transition from the hospital to skilled nursing care. And then if you're in skilled nursing care and your doctor releases you to go home, but wants you to have home health care, our nurses are there to make sure that your home health care is going as planned. If you need any durable medical equipment, you're getting the care that you need. If you have something severe and complex going on, then our nurses will speak to you one-on-one and work with you and your families through your health issues. One of the programs we offer is a healthy home visit. So, what exactly is a healthy home visit? Well, a healthy home visit is a completely voluntary program that, if you choose to take part in, a nurse or doctor will come to your home to review your healthcare needs and do a home safety assessment. The visit does not replace care from your doctors, but works with them to help meet your health needs. The nurse will focus on safety in your home. They'll do a medication review and ask about your medical and family history. We may recommend any of our support programs that may be helpful for you. We do a holistic health screening, and with your permission, we share the results with your doctor. Resources for Living offers support to make life easier and more enjoyable. By calling Resources for Living, you can be connected to a wide range of cost-effective and reliable local resources that you may need, such as cleaning services, lawn care, and home repair. And you only need to pay for the cost of the service itself. There are Resources for Living life consultants that can help you find social and recreational activities in your local area. This program is also available to support your caregivers. Help for caregivers includes finding caregiver support groups, respite care for short-term care to relieve caregivers, and life assistance to manage everyday issues. This service is a part of your Aetna Medicare Advantage plan, so there's no additional cost to you to use Resources for Living. Staying independent is important to all of us, and our fall prevention program can help you be more aware of what increases your risk of falling and how you can decrease your risk of falls. Some of the ways include by building lower body strength, checking your vision, and making sure your home is safe. Our healthy home visit can include a fall risk assessment as well as demonstrate beneficial exercises. Our fall prevention program is a voluntary program. It is part of your Aetna Medicare Advantage plan, so there's no additional cost to you. Here's a timeline of the items that you will receive. If you haven't already, you will receive an informational kit, which will identify which plan you will be rolling into for 2021. Then once your enrollment is received, you will receive a confirmation letter, acknowledging your enrollment into the Aetna Medicare Advantage plan. After that, you will receive your ID card as well as a welcome kit, giving you more information about your new plan. Your benefits will become effective January 1st of 2021. Aetna is committed to helping you reach your healthcare goals, whatever they may be. And based on our member satisfaction surveys, we have achieved a 96% overall satisfaction from our Aetna Medicare Advantage plan members. So what's next? You'll be automatically enrolled in the Aetna Medicare Advantage plan effective January 1st of 2021. You don't need to do anything. However, if you want to opt out of the Aetna Medicare Advantage PPO ESA plan through Genesee County, you can before November 23rd by calling Aetna's pre-enrollment call center at 1-800-307-4830, Monday through Friday, 8 a.m. to 9 p.m. Eastern Time. Please keep in mind, if you opt out of the Aetna Medicare Advantage ESA PPO plan for 2021, you will still have coverage under Original Medicare, but to re-enroll in the Genesee County plan, you will have to wait until open enrollment next year or have a qualifying event. If you have questions about the Aetna Medicare Advantage plans prior to enrollment, you can call us at 1-800-307-4830, Monday through Friday, 8 a.m. to 9 p.m. Eastern Time. You can also go to our Aetna website at aetnaretireeplans.com for more information. If you want to opt out of the Genesee County Aetna plan, please call Aetna at 1-800-307-4830. And again, that's Monday through Friday, 8 a.m. to 9 p.m. Eastern Time. We are excited for you to start enjoying your new plan. Thank you for your time.